My name is Connor Johnson, and I'm a lymphoma physician at Massachusetts General Hospital in the Center for Lymphoma. CAR T-cell therapy has revolutionized the outcomes for patients with relapsed refractory large B-cell lymphomas. As many of us know, there are now 3 fully FDA-approved anti-CD19 CAR T-cell products for large B-cell lymphomas: axi-cel, tiza-cel, and liso-cel, or lisocabtagene maraleucel. Recent data has emerged looking at the real-world outcomes of liso-cel, and this is an important topic for any therapy. I think we always want to have an understanding of how clinical trial results translate to real-world scenarios, especially because clinical trial criteria restrict patient access, and many times outcomes don't always translate to similar results in real-world scenarios. A study by Crombie and colleagues looked at 323 patients over 50 sites treated in 2021 and 2022 with commercial liso-cel. And the take-home from this is that results were very similar to that seen in the pivotal studies of liso-cel. Specifically, patients on this study had a median age of 70 years, with the oldest being 91 years of age. The vast majority of patients had diffuse large B-cell lymphoma, not otherwise specified, though about 12% of patients had high-grade B-cell lymphoma. The median prior lines of therapy was 3, and the median vein-to-vein time was 36 days. In terms of response rates and clinical efficacy, the overall response rate was 79%, with a complete response rate of 65%, really mirroring that seen in pivotal studies of liso-cel. In terms of duration of response or progression-free survival, at 6 months, 2/3 of patients remained progression-free. In respect to critical toxicities of interest, namely cytokine release syndrome and neurologic toxicity, or ICANS, the rate of cytokine release syndrome was 52%, with 3% of patients having grade 3 or higher events. And the rates for neurologic toxicity were about 30% for patients having any neurologic toxicity and 11% having grade 3 or higher events. And these incidence rates are very similar to that seen in the pivotal study. So my take home from this real-world data of liso-cel is that the real-world outcomes appear to mirror that seen in clinical trials, which is very encouraging for broader applicability of the liso-cel data to patients. Thank you so much for your time.